And I think how you commercialize digital health products has been really a new era in healthcare. And under the age of COVID, we've seen rapid adoption, rapid changes, and even more to come. So I think what we're here with John is going to be a really enlightening situation for us to learn how he's done it over the course of his last 10 years, largely in the digital health space. So John, I'm so glad you're here. Why don't you tell us just a little bit about how you got started and your background?
Yeah, thank you kindly, and I appreciate the introduction and I appreciate the collaboration. So, first and foremost, thank you, Laurie, and thank you, Danny, if you're on. But thanks, Northeastern. So, I truly, I'm grateful for the opportunities that Northeastern afforded me for really my entry into healthcare. So, I was a business student at Northeastern in the 90s when, at the time, healthcare wasn't even on my radar, right? So, I just assumed that I was a marketing and MIS student, and I just figured I'd come out and work for a .com like everybody else at the time. And I was blessed with the opportunity where I'm assuming everybody on this call knows what a co-op is, right? So I was blessed to have a co-op my senior year with Sharon Plow, a pharmaceutical company. So at 21, I was spoiled with a company car and American Express and wearing a suit and tie to work every day. And it was really a nice opportunity, but that was my entryway into healthcare. So I spent the next 5 years in the pharma side, and then I had the opportunity to go work on the device side for another 4 or 5. And really, the past 12, it's been digital health, and it's really opened my eyes to a lot of things here. Where traditionally, healthcare was something that was viewed as, medicine is viewed as it's a pill. You know what it does, right? It doesn't change much over time. And a device, whether it's a knee implant or some other type of brace, it doesn't change much over time. But when you get into technology and software as a medical device or digital therapeutics, like any technology, it's expected to get better, faster, cheaper, stronger over time. So that's really some of the excitement at the intersection of digital health and traditional healthcare. So, that's just a glimpse of some of the things I've done. I've been blessed with the opportunity to lead 3 different technology startups out of Harvard and the Mass General ecosystem. And with those opportunities, it's really allowed me to see and do a lot of cool things across the Z states, but also on the other side of fundraising and interacting with patients directly, but interaction with providers, payers, PBMs. So I've been blessed with just a 360-degree view of the world. And I'm really at a point now where I think every organization has to bring that perspective to market to be able to build technology that can live and play in an ecosystem that fits in each of those different verticals.
And John, let's dive into that a little bit. And anybody who has questions, jump in. But I think a lot of people have that question. What are those important key things that any startup, that especially in the digital health space, has to look at as they're looking to examine? You've been with 3 of them. You've
Yeah.
definitely helped make the market for payers to actually reimburse for them. But what are those things that people that are in the digital health spaces are looking to start out really should be thinking about in the market that you've seen those people actually have caused either to fail or not go on because they haven't really thought out those steps? Can you give any advice into those early days of digital health startups?
Yeah, absolutely. I think, in digital health, especially, you have a lot of folks who start an organization within this space for a reason, right? It's either a physician founder because they are doing something and they see a need for a tool or technology that they just don't have, or they have, but it's inadequate. Or you see somebody that just has a disease, that's a tech person, or that's a business person that wants to bring a solution to market to support people just like them, or just like their child or their spouse. But those are missionaries, right? They're building a product to help people, which I commend you, and that's why we're in healthcare. But they don't build it with a revenue model in mind, or how is this ever going to make money? And sometimes I hate to say it, but no money, no mission, right? So if you can't sell it, then it's hard to get it in the hands of people who need it. And if it's something that's so niched and so narrow that it's not fundable, not only are you not able to bootstrap and drive revenue to build it yourself, but you can't even raise outside money to get it off the ground. So build something with an idea of actually what the business model is and how you will be paid. And for the business students in Northeastern or any school, that's not a foreign concept to them because it's part of their curriculum. But other disciplines and other areas of study, that is foreign at times. So that is why it's so powerful to have diversity among co-founders, right? If you have great co-founders, it's great if one's a clinician and one's has a business acumen and one is a tech person. So I do encourage, diversity among the co-founders, but try to identify your business model as early as you can. It most likely will change, but at least you have an idea that you can bring to investors that's fundable, or at least if you try to go and acquire customers and sales, you can at least explain to people of how your company makes money and why they should have confidence that you'll be in existence in 2 or 3 years.
Let's talk about co-founders to unpack that a little bit more, because it is a conversation that I spend a lot of time with other people with, on nurses who are starting businesses, young startups starting things, on the boards that I sit on. You know, it all comes down to the team that you put around us. And then we're going to talk about getting out there and raising funds. But talk about what you said, you need diversity on that team. But talk to us, if you're going to be building a company, what you mean by that diversity of team, because you, John, have an incredible skill set. Let's talk about, if you were building a company today, what your skill set is and the type of skill sets you would be looking to surround yourself with.
Thank you. So part of that diversity is, so here I am. I'm a 40-year-old white guy from Boston, right? I'm pretty narrow in what I know in that side, right? And this is a real example, right? I have a deep passion for women's health, right? And that's something I want to bring to fruition. But who am I to tell women what they need, right? So part of that is you need diversity among gender. I think is very important. I think you need it among, culturally, you need it because everyone has a different perspective. And if someone's going to tell you your baby's ugly, it should be your co-founder that's telling you that, you're wrong, right? Those are people you can have a candid conversation with, and you want their trust and their honesty. And skill set. If I was looking for a co-founder, I need someone technically savvy, right? That can understand AWS and building a stack and bringing all of that to fruition, right? From the stuff that's in the background to the stuff that's patient and client facing. You need someone that can live in that ecosystem, but also someone that actually knows how to manage dollars and how to raise money, because you'll see companies that are doing a good job. You've got one co-founder where they're the tech person. Then you've got the other one who's the evangelist, right? They're the charismatic front person that goes out and woman can take a stage and everybody's clapping and they adore that person. That's the face of the company, right? So you need someone that has the ability to go out and have tough conversations, be the face of the organization. You need that person that can operationally and technically put it all together. And you need someone else there that's actually continuing to ask the question, how do we make money, right? How much do we need? What's the burn? What's our ARR? What's our MRR? What's our cost to acquire a customer, lifetime value? You need someone that's asking that, because without that, you have no idea how to price it, how to position it, how much runway you need. In healthcare versus tech companies, right? Any tech company, they'll go out and raise 18 months of runway. And you can usually validate a product in the market and bring it to market and commercialize it. And you'll know pretty quickly if you have legs or not. In healthcare, that's not the case. You need 3 years of runway. You need 3 years of runway to figure out your product's not going to make it, let alone actually have a chance to make it. So, that's a part of it.
John, I love that you're saying that. And you're right. We always need the person on the team who can also ask for money. And I don't think people very much understand that importance of being somebody that's going to be able to put together a business case set. So somebody just asked, before we jump into that next question, which I want to unpack with you more, is what is the best way to find those co-founders, which is a really tough one. And then I guess we could always dive into equity, but I think we should host that for a later conversation. Sure. Let's talk about how you think you should find co-founders.
Right. So, it's a great question. And I think I view finding co-founders just like dating or looking for a job. If you see something attractive in someone else that you desire or you think is complementary to you, go talk to them. It could be someone you don't know, but if you admire someone's work or their knowledge in a particular space, go bring your idea to them. There's a lot of people that would be amazing in startups that just don't have the idea they want to take off the ground, but absolutely have the skill set, the passion, the drive, the risk appetite, all of those things that make a wonderful co-founder. So like I said, if it's no different than finding a spouse or a job, I'm at Happify Health right now, a company that I've admired for a long time. Because for a few reasons, I admired them when I was the president of Empathetics, and I used to take all their press releases and all their stuff, and I would show it to my board and say, this is why this space is so great. When I lost my job last year during the pandemic, the first thing I did was email the chairman and the founder of Happify and said, I still think you're amazing. I'd really like to work for your company if there's a role for me. And here I am, right? So if you see something you like, you have to go and get it. Or someone else will.
And and that's exactly it. I think that don't let other people stop your dreams from happening is what you're saying, but also co-founders are tricky. And sometimes there's a co-founder who you guys always joke is there's Mr. Right and then there's Mr. Right now. And sometimes just to get an idea off the ground, teams break and fracture. We often see that change happens around 18 months to 2 years within companies, but the best co-founders are people who find skill sets that complement each other. And one of the best ways that you can do that is showing up at events like these, networking and asking, hey, I am somebody who is looking for this. I run a nonprofit in nursing. We do monthly meetups. I can't tell you how many nurse innovators show up on a regular basis that's like, look, I'm starting a company and I'm looking for somebody with this skill set and how successful they are. If you're building a tech company, showing up at hackathons so that you can find a person to do that person with you. There's a lot of places that people are looking to engage. And in this virtual era, showing up, you have access to doing a lot of those things. And I know a couple of you guys are pretty successful entrepreneurs on this, but you can always find that. So John, when we're talking about going out and raising money, there's a couple different things that need to happen. And let's be honest, digital health startups have, especially in the population health era, hit the wall and 90% of them failed within 5 years, right? Very hard to gain some strategies, some tragic. What is the first, all right, let's talk about the phases of raising money. Where do you go first? Who are the first people that, and what I think there's some fundamental misunderstanding when you're a young startup, where those first dollars come from. So do you want to talk about like, hey, what's the first place? Where's the first dollar coming from?
Yeah. So typically, well, historically and typically, they say it's, it's bootstrap and friends and family, right?
So everybody knows what bootstrap means. Just dive in and tell what bootstrap means, John.
You're doing it. You're grinding it out yourself. Every extra dollar you have goes into the company. Whatever dollar you make stays in the company. You wear 20 hats. You do everything. You get as much pro bono and free services as you can from anybody, from accounting to lawyers to whatever. They may not be the best accountant or the best lawyer, but they're free and you can afford them. So you take what you can get and you try to grow this thing to the point where you have a minimum viable product or some type of confidence that the product has legs. And then you start to look at angels for some type of seed money. And and again, I didn't have friends and family that had any money, right? So that's something where a lot of people say, well, I don't know anybody with any money. That's okay. The hackathons, like Rebecca said, I can't tell you enough the power those have to come up with a product, a co-founder, find investors. It's networking, right? So when you tell people what you're doing, you just scream it from the mountains, and somebody will know somebody that's either has a passion in that space, has a friend that's investing in that space, has a rich dentist that wants to put 50 grand to work in something. That's what most angel groups are. It's doctors and dentists and dry cleaners that have money that they want to put to work. So that investor, that initial round of cash, it could be a dry cleaner, it could be a dentist, it could be whoever, but tell people what you're doing. And the best thing they can do for you besides giving you money, and sometimes you don't want everybody's money, but the best thing they can do for you is introduce you to somebody that makes you smarter, gives you knowledge, or gives you direction. So yeah, typically that first dollar is friends and family. If you don't have that, then you're trying to go to angels, and the angel is just, it's a wealthy individual, right? It's someone that can give you 50 to a couple $100,000, $1 million or more as an individual to help get you off the ground. And they're around. There's a lot of them. They may be just retired folks that are looking to stay busy, retired executives that are putting money to work. But talk to, especially in school, some of your friends that are in finance or other schools or work in hospitals. They know people that are looking to do something with their retirement money or with their money to grow. They have money they don't need to touch for 20 or 30 years or less, and they want to put it somewhere. And you may be, someone they're willing to bet on.
The conversation is, and I remember somebody saying this, that, if you never ask, the answer will always be no. And I think getting really comfortable with getting across that to find that evangelist or that person that believe in you is one of those first steps. So I think when we're also looking at this, and maybe we're diving a little bit into the weeds, we're going to jump into this digital health thing. There's a couple things that have actually exploded in the course of the last decade, which I think is remarkable, which are a lot of these incubators and accelerators for small companies along those lines. So do you want to talk a little bit, John, especially because I think in the digital health space, space. Why are these things like incubators, and what are they, accelerators, in the marketplace? Why are they of value to companies that if you were thinking of starting a company, why should you even look in that direction?
Yeah. So you'll hear them, and there's things like Y Combinator and Mass Challenge and some of these others that I adore. I adore Mass Challenge. I've been a finalist in Mass Challenge. I've been a participant in helping them, and Y Combinator, what they do for you. So one, if you get accepted into it, it gives you visibility, right? It gives you latitude as an organization that you would have struggled to get on your own. They can get you in front of thousands of people. And it, they'll partner you up with a mentor. Mentorship is critical, right? I mean, I can't be more grateful to the mentors that I have and have had over the years, to help me just be hard on me sometimes, or just give me guidance from their own career. And it's at all different levels of your career. Your mentor could be someone who sits across the hall from you, right? It's someone that may just be 10 years ahead of you in their career, that genuinely just wants to see you be successful. Or it could be, when I was CEO of one of my prior companies, it's a lonely job. It's a very lonely job. And one of my board members was genuinely cared about me, and he was a great mentor, and he still is. And so back to the accelerators, it gives you latitude, it gives you visibility, it helps you build a formidable company, that will be fundable, that has a chance to be successful. It fills in all the blind spots that you don't even know you have, right? And they will often help you identify a co-founder, because they'll pull people together that have the same passion, the same interest, different skill sets, right? You both lack that other half that you need. Both of you may come in with one company idea and leave with the joint one. And I hope that happens to you. So there's just some tremendous opportunity there. But the other thing with any of the more well-known accelerators is that they get visibility by big dollars, right? There's a lot of investment groups that look at certain accelerators, as companies that are fundable. And often, if somebody funds you early stage, and it's a reputable group of funding source, that will attract other big name funding sources. So money follows money, right? They view you as vetted and safe. But there's a lot of accelerators, and they all have different points where they're impactful. Some are very specific, like Sanofi and J&J. They all have different value they can bring you, and they're amazing. But they're not for everybody. And there's other ones I've worked with that are specific to women founders, right? Different ones, Sophia Angels in Minneapolis and 37 Angels in New York. They just want women founders. Go for that. If you're a female founder, that's all you. Like, take advantage of it. Take advantage of people that want you to be successful. So back to the accelerator, I think, it just makes you better than you are. And it helps you identify all those areas that it would have taken you 2 years to identify. It gives you visibility and a different perspective on your organization that you would have lacked had you not had constructive criticism in the fashion that an accelerator can provide.
Yeah, and just one of the shout outs for HSE, that was my own experience. That was my first time. I had no idea that accelerators existed or that they would apply to people like me being a nurse. And so when I went through HSE, it was just a life-changing opportunity, because I started to learn all the things I didn't know what I needed to do, and led me to sell my company, even though I never had the confidence to take money from others. We were acquired, and that was something that was a big deal in a world that I had constantly failed. And it was just this confidence to find that group around you who said, hey, this is what you should be thinking about, and these are the next steps you should be going forward. Because the truth is, even the best, even those who have gone out and started 2 or 3 companies, still need guidance from others who have more experience in different ways. And I think when you look at these programs, even some of the best people that I know that have sold their companies on their second or third companies, they're back in accelerators because they recognize there's an unfair advantage when you get to put into these programs because of the connections you make. Because business is not only about what your passion is, but often who you know. So John, let's dive into the world of digital health, because digital health had a real hard path getting forward and getting adopted, right? There was a lot of questions. So let's tackle why people first did not buy into digital health as something that was reimbursable or fundable, or actually there was some talks about fundable, but let's talk about the world of digital health and how it came to be, and some of those early examples of places that it started showing up and paving that pathway for where we exist today.
Yeah. Part of the challenge with digital health is it depends on who's viewing it and what their perspective is, but also I'll give you the example of digital therapeutics, right? This is a space that has really just been evolving. I think I first got involved with the digital therapeutics company in 2015. We were calling it digital prescriptions. And it was something where we would go and present to either a health system or a health plan, and they would say, what are you? Are you a drug? Are you a device? Are you education? Like, what are you guys? And then you'd explain to them, this is what we do, and this is how we can improve outcomes. And they would say, well, I don't know how I would ever adjudicate a claim for you. Like, I don't even know how to pay you. And that was part of the challenge. We come into this place where it's this really, we couldn't have picked a more difficult world to play in, right? You need someone to come up with an idea. You need a doctor to prescribe it to a patient be willing to use it, a health plan be willing to reimburse for it. You need a pharmacy be willing to dispense it, or a PBM be willing to put you on formulary so the doctor even knows you exist. It's chaos. It's absolute chaos. And then,
John, real quick, can you explain what a PBM is? Because I'm guessing that's not a general term.
Sorry, folks. It's a pharmacy benefit management. So think of Walgreens or CVS Caremark, or it was formerly known as Express Scripts, is now known as Evernorth. And then, so what they do is they're the pharmacy benefit manager for your health insurance company. So all of us in Boston, where we've always been just drowning in managed care or health insurance, your health insurance company has a formulary. So if you go to get any type of medication for whatever whether it's allergies, asthma, hypertension, there's a formulary, and the doctor is told this is first tier, second tier, third tier, and that determines if any of you have ever gone to get medicine at the pharmacy. Your copay is either $5 or $25 or $50 or $300. It depends on what tier that drug was. So the doctors, and again, many of them are capitated. They are told, hey, if you go with the preferred drug, that doesn't affect your capitation. You get to keep your money. If you start going down this tier and the health insurance company's paying for more expensive drugs now, we're going to take some money away from you too, Mr. Doctor. So stick with the ones that we tell you can prescribe. So me and you, we get what we think we're getting, what the doctor thinks is best for us. And I hope that's the case. But often we get what shows up first on their list because someone else told them that's what they have to prescribe. And I'm not trying to, knock clinicians.
But John, actually, let's dive into that just a minute, a little bit better. So capitation payments, I think that it's people don't necessarily understand why that's such a significant risk to the marketplace or how that motivates. So let's unpack that a little bit further. So right now, doctors are part of health plans. And let's start back there, right? And talk about, let's unpack a little bit of this structure, because this is really valuable information that I think people are like, oh, I'm going to launch this and doctors are going to prescribe it and this is going to be reimbursed. And there's a lot behind the scenes. And actually, I think one of those tied to some of these health plans right now is on. So we're going to talk about, but keep going on what you're talking about here, because I think just unpack a little bit further for some of the people that are listening.
Yep. So there's different types of risk models, right? So a physician may be at risk, right? So which means they're penalized for certain procedures if they vary from the protocol and the process. One, they're incentivized if they stick with it, but two, they're penalized if they stray. So that's often it creates a very challenging scenario for a clinician because they want to practice the best medicine they can, right? And what we have to be understanding of is the fact that often that costs them as well. To order tests for you, to prescribe you certain things, to practice certain procedures on you. So if you have a great doctor that's very thorough, doing a lot of that for you, understand there's a cost to them for that too. So they should be thanked and rewarded for that. But they're in this unique scenario where they're forced, their performance is measured on sticking to the script and following the rules. So that's where they can make the most money. And I'm not trying to go on a tyrant.
Not only most money, right? But John, but also there's things called pre-auths and prior auths. And when you go off script, it takes time and efficiency. If you've ever heard of people that you hear, hey, this patient was denied getting a CT scan and the doctor had to follow up and follow up and follow up. What they've started to realize, right, is there's a road that you walk, and getting external things that aren't part of that script approved take time, money, and resources to get those approved. And then in the long scheme, as they are measured by their terms of success and renewal approvals for their contracts to be reimbursed by provider payers, those processes could actually lead to a lower reimbursement the following year if they went off script a certain number of times. So digital therapeutics has not yet fallen into a lot of these scripts, but John, dive in, because that's
But it has
exactly.
to, right? So we're in this scenario where there's incredible digital therapeutics available, right? And a digital therapeutic can mean, and Megan Coder talked on this, right? It could mean a few different things, right? It could be where the technology or the app is the intervention, right? And that's managed like a drug. It's claims processed the same way, it's the drug benefit. There's others where the app is a companion software, where it works in collaboration with a pharmaceutical agent. So it either helps you identify the correct dosage of insulin, or some other type of dosage of a medication to minimize the side effects profile or keep you on it longer, get you to the right dose to manage your condition based on whatever your vitals are. Or the third is where the technology manages a condition. So think of diabetes or heart disease, or some insomnia. It could be any other condition. So there's different types of digital therapeutics. And for traditionally or presently, as a doctor e-prescribes, you're not even in their ecosystem yet. So one is there's nothing that puts your product in front of that doctor. So if I go to look for something for diabetes or hypertension, I don't see that app for hypertension. I see beta blockers, and I see other ACE inhibitors, and I see all these other drugs that are there because that's what they're incentivized to do. So digital therapeutics, they have to, one, become part of that ecosystem where they're at least visible to the clinician, prescribable. The patient understands how to utilize it. But for a doctor, it's easy now. You dispense. I go to Target, pick up my medication. The pharmacist says, do you have any questions? It's a little different with software because the doctors never had to worry about, does this particular patient have a tablet or an Android or an Apple? If you go to the pharmacist, they don't know how to answer your questions because they've never actually seen the digital technology either. So there's some other things that companies like ours and digital therapeutics need to be aware of as far as patient activation and engagement, and making sure that, we're doing everything in our power to educate, inform, and keep people on the right track to use things efficiently. So that's one part of it. The other part is,
John, I want to just clarify the part that you're speaking about when this part is referred to as those kind of programs that are reimbursable by payers, which have to be associated as an NDC code. So those are programs that payers will pay for and do that. But there's another, and on these things also referred to as patient engagement programs or patient support programs are known as. And so they can have an NDC code of those, but to circumvent, not necessarily circumvent payers, there's another way to access and get patient engagement programs to be paid for. And I think, John, why don't we talk about that other model that exists outside of the payer ones, which I think who's going to pay for it and who's actually been the one starting to take responsibility for these digital programs in a major way. Do you feel comfortable? Do you want to go there?
So I'm fine with it. I think you're talking about Pharma. If that's
exactly what we're talking about.
Okay, yeah, indeed. So, right. So I think that's the way for it to go, right? So for digital health companies as well, and I don't care who it is. Look, the past Q1 of this year, $7 billion was invested in digital health, right? The best we've ever seen. 145 deals, averaging $45 million a piece, like incredible money in this space. Every one of those companies, and I'll challenge it, almost every one of those companies is taking pharma money at some point because it's good money. It keeps your lights on. It helps you validate your product, get it off the ground. So pharma, and I think the smart ones, pharma, if you're working with digital health, there's so many reasons, and I don't want to go too far off path, but there's so many reasons why this is powerful for pharma right now. It takes hundreds of millions of dollars to bring a pharmaceutical product to market, right? In years of regulation and compliance and trial and error to find a molecule that's actually effective and you can bring to market. And then you have X amount of years to make your money at single digit margins, and then it goes OTC or generic. And if you didn't make your money, you didn't make your money. With digital therapeutics or digital health, you can come and bring a technology to market in a vertical for 10, 20, $30 million in a space where you had zero presence last year. I can enter a new disease state with a technology that I never had a footprint in, or I can buy a generic or an orphan drug and put a new technology or delivery system on it and have a fighting chance in a space that's I've never even existed in. So it's giving pharma all this opportunity to penetrate other verticals. And the other thing is pharmaceutical companies, all they know when they prescribe you something is, did you refill the prescription? And if you didn't refill the prescription, they don't know if you went to a different drug, if you stopped taking the medicine, if you lost 50 pounds and you don't have high blood pressure anymore, if you died. They don't know anything except you didn't refill the medicine. When there's a technology transmitting data, there's a few different things that are very powerful for them. They know they can get you to the right dose or a higher dose faster. And many drugs, think of oncology or cancer, those are tens of thousands of dollars for over a year for someone to be on that regimen. So every refill could be worth $5, $10, $15,000. If I can get you to stand one more month, that could be 15 grand. So pharma really sees a powerful opportunity here for the data and the actionable insight and information to come back to them. So I think the pharma companies that are doing it wise, they're incentivizing their sales force to leverage the technology and the relationships they have. Because if you don't incentivize your pharma sales team, they don't sell it. They sell what they make money on. So if you incentivize them correctly to do it, great. You have to find a way to incentivize the physicians if it's possible. Or you provide value to their patients through some type of patient support program or a technology that's absorbed into the cost of the medication. Because I read something today that for a Medicare population, a difference in as little as $10 in a medication will cause people to stop refilling it and stop using it. So if you can reduce the impact of the financial impact on a patient, they're more likely to be compliant and adhere to a regimen. So for pharma, this is very rich and lucrative for them. So they will fund these patient support programs, especially in audiences where there's disparities, right? So there'll be programs there where folks with Medicaid or other things can have a $0 copay and get them on it because they want to own the market, right? So they'll give away a lot of product for free to own the market. So
I just want to tell you guys the value of what John just shared with you is substantial. And the message is that not always the way to get to market is going through the payers. In the space that has really adopted digital health in a major way is life science companies. And so if you guys had it, this is one of the best informations that you guys, if you're looking to enter the digital health space, you need to be looking and reevaluating, because if you're looking for payers to reimburse you, it's a market that's going to be hard. This kind of insight, John, thank you. That's incredible secret sauce on. It's not even secret, but for you and where I sit at my own organization, OptimizeRx, those who make the wheels turn are pharma and life science who fund the way that we communicate. Because let's be honest, I don't know if you know this, but life science companies spend $20 billion a year alone in the United States trying to reach physicians. And if we can do more through patient engagement programs to support physicians in the jobs, or the clinicians in the jobs that they're doing, through patient engagement programs, through the data we collect, through the adherence that they're doing to driving outcomes, it is a win-win for everyone. In my opinion, actually, patient engagement programs becomes the one space that pharma, life science companies, and life science companies, payers, and providers can all get behind, because they really do drive impact. So this is some super smart information, John. I think this is absolutely fantastic. And one of the things that I think one of these questions is how do you validate that what you're doing is working? And how do you do that fast? And I think we always say, success is a long road, but failing fast is almost equally as important. And I know we've talked about that a little bit. So do you want to dive into some of this as well?
Yeah, definitely. So the earlier stage you are, it's hard to know, right? If you have traction or market validation, it could be something as basic as surveys, right? You can survey an audience of 100 people that you think would be an ideal user and customer for yours, for your product, and survey them. That's a great way to capture information. But also, actually, before you brand and market, talk to the people who will be the ones either using it, dispensing it, utilizing it. Ask them what they need, because there's a lot of time, and I can't stand companies. They build things to say, we're going to build it, someone will buy it. That is not true. They will not buy it. You will go out of business. You will lay off everybody, and you will never get hired again because you were a fool. So you have to actually go out there and seek feedback, constructive criticism. Like I said, someone has to tell you your baby's ugly sometimes to make you better. So go out there, be open to it. Even if you don't care what the person says, at least hear them. You don't have to listen to them, but at least hear what they're saying to you, because that's a perspective that you didn't have. And they may
And
seem,
actually, John, if I can say something, the importance of surveys are so important because so many of us have beliefs, but until we validate them, you're not going to be able to also raise funds. And so here's some easy ways to do things like this. Surveys, go on Facebook and post like, hey, I need help with a question. Can you guys answer this? Have you guys ever seen people who've gone out and said, who likes this logo versus this logo? And there's thousands of comments on Facebook. How many of you guys have seen that? Raise your hand. Same things can be done in this situation. Monkey Survey is a free tool, up to 10 questions that will allow you to email 100 people and grab things like this. The more often that you can say, hey, I went out and surveyed, this is the amount of responses I got, the better you are about feeling the confidence in your own product. But if you're going to have to raise funds and ask friends for family, they're going to want to know if you can say, hey, I got feedback from 500 people or 1,000 people on this, and this is what 70% of respondents said to me. Do you know what people are going to say? And if suddenly 94% of your respondents are saying that to you, do you know that people are going to want to give you money because you've done your homework? And a survey, what John just spoke to, is absolutely the right thing. And best business practices are, John, we know the importance of keep going out and surveying that audience, but that is exactly, and I think I cut you off, so keep going if I.
No, and one of the things is where I think to validate your product is, I do follow the school of thought of the customer is always right? If they're a paying customer, they're paying you to deliver something you promised to deliver. You should do that, right? Or at least be honest and open with them if you can't and why you can't. And they're understanding. They're human as well, right? If just be realistic in setting your expectations. But I get incredibly frustrated when I see companies that don't want to do the right thing by the customer. And that's the quickest way to lose them and your future ones, because people do talk. So surveys are there. Listen to your customers if you're lucky enough to have any, because they will help you get more. They'll be your testimonial site. They will help you learn where you are terrible and get better. And if you're doing a great job and they see you doing a better job, they'll stick with you and expand your business. So that's a big part of it as well. Also, look at your competitors where they're having success. And I'm not talking about like their press release success, because press release, they're crap, right? Everybody puts out press release to make it look like they have a powerful business. It's crap. Actually call someone at the company and ask them what's going well and what's terrible with your company. They will tell you everything that sucks at their company, and they will tell you everything that's awesome at their company. It's that simple. If you're going to look for a job and you're going to go work at a company, call the people that work there and ask them, how is it? They'll tell you run and hide if it's terrible. They will tell you trade out. So with that saying, that's the same way you validate your product. Call your competitors, ask them, what's your biggest challenge? And I'm going to be, here's inside information. I still do it to this day. I will call my competitors, tell them I'm a student in university, I'm doing a capstone project. I need to know all about your company. And they will tell me everything about their damn company. I do that to this day. I still do that. And they will tell me everything, how much money they have, how much money they don't have, why the last 25 people quit, where the bugs in the product are. They will give you the keys to the kingdom. You're a student, you're a young startup person. Call and ask honest questions, and they will tell you everything. And when you get to be my age in your 40s, lie and say you're still a student, and they will tell you everything.
I love it. It's very interesting. And honestly, let's be honest, in the world of startups, guerrilla marketing, guerrilla warfare is some of those things that you have to do, because the truth is you don't have the budgets nor the money to be able to effectively navigate those that do. And the truth is that as we're looking to grow these things, and as you're looking to start a business, or for those of you entering the areas of digital health, the market has been saturated for years. And those that have been successful, you guys, I hate to tell, I say this to people all the time, young startups, perception is reality a lot that's out there. So although press releases are usually false, it's because the people that have gotten really good at communicating what they're doing, who their clients are, or their relationships are, and making it appear that they're having a lot of success, often do. And I was just talking with a young startup earlier today, and I said, you know what, the first person to market in the whole babysitting space was Sitter City. You know who they got trounced by? Care.com. Why? Because Care.com and doubled down on PR and marketing and messaging in a really effective way and going after their market. So I don't think that we should lose the importance of getting your story out there. When I was at Northeastern and we built the Nurse Innovation Program, why did that scale as fast and high as that did? And why did we dominate on SEO in those lines? Because we constantly put out information out there featuring those who were coming to speak and showing the impact that we were having, and quickly scaled to the highest success that we were out there. And the truth is, it was me for most of that time with not one assistant, right? But we made it appear that there was an entire team building the most successful program in the entire country to go for it because we did this. So here is the reality. All of you have the ability to do that. all of you have the ability to present what you want to the world. And we know behind the scenes that making the sausages, it's a disaster. But John, what are you thinking? And I want other people to jump in here and put in some questions as well.
So I agree with you. Optics are important, right? And this is even early stage. The more polished you come across, people will build confidence in what you're saying and what you're doing, right? Know your numbers hard, know your sources, know your market, and you do that through research, through surveying. But optics are powerful. So if you come across as somebody, and again, at some point we'll all depend on the kindness of strangers to advance our organization, our personal career. Come across as genuine, as someone who's passionate. They don't invest in your idea as much as they invest in you, and that's a fact. And that's your founding team. Your idea, it might be pretty good. Someone's going to help you make it better, but they're investing in you, your passion, your aspirations. Do you have the DNA and the resiliency to stick with something, or are you easily distracted and you're on to the next thing? So that's where it comes from, right? Do I like this person? Can I work with this person? Can I mentor this person? Are they coachable? That's all powerful stuff. But optics are so powerful, and you'll see it now. I guarantee you, if you go on LinkedIn and you look at certain companies, they'll have 150 job openings posted. There's only 30 people in the company, but they have 150 openings. So it's optics. They're trying to look powerful and formidable and make a show of force in the space. So there's good practices there. And right now, honestly, it's so easy through social media and using different design packages and everything. You can make your stuff look just as polished and powerful as a company with a tremendous amount more money and people doing things than you. You can look just as powerful.
And actually, John, it's really interesting that yesterday I did you a panel for the New York Institute of Medicine. And on this panel was a person by the name of Dr. Mike, right? Now, Dr. Mike is a primary care physician in a rural health community department. You know what he did? He got on social media on YouTube, and he has a following of 40 million individuals. Who do you think is being asked to speak, showing up on TV, doing all these things? It's not the lead epidemiologist at a lot of these healthcare centers that are talking about COVID, but it was he who signed the Yahoo deal on search terms and things like this. So the power of social media, you guys, is real. It was something I never personally invested in. I don't think John is personally invested in it terribly. But the truth is if you want to have a presence, there's a couple people on this call who are growing their presence pretty dramatically. And the truth is the success to social media, it's not super hard. The success is continually showing up. A lot of people start it for a short period of time. They do it for a week or two. They do it for a month. But the reality is that when you're going to make an investment and you're trying to grow, you need to commit to it same time, same date, same system to grow that on social media. And the truth is, in the long run, the way that health is being delivered, the way that information is being consumed, a strong social media platform is going to be actually, I think, pretty fundamentally necessary going forward in the future. And if you don't have that, finding somebody with that skill set could be a good one to do as well. But John, that's just some of the information I've been taking away from recent conversations, talking with a couple of people that I'm just blown away by how their success has gone in the course of who they were a year ago to where they are today and what that's happened for them.
Yeah, indeed. And it's, Rebecca, I think you touched on, it's that cadence, right? So the content is important, but it's actually the calendar and the cadence. And there's so many tools you can use now that are inexpensive, if not free, to allow you to set this up where you become a frequent visible part of people's feeds on different platforms, different modalities. But it's the content. You can make yourself a thought leader in a space pretty easily by sharing content that's not even your own, and just with the frequency and conviction and a calendar and a cadence that it positions you really as an expert in the space, like Dr. Mike in rural America, who now is getting asked to speak at engagements that would typically be the head of someone at Mass General or Columbia or Duke. You've got a guy now from rural America who's built a following and is benefiting from that.
Incredible stuff that can happen there. So, all right, you guys, who wants to put on their camera, ask a question, and then if we haven't covered them, I just think that this is a really important conversation. When you have somebody like John here, I know sometimes typing him feels a little nervous, so come on off and ask us a question of what you guys think is questions that you have for John. His understanding on the payer side is really amazing, but also his understanding on the life science side is really good as well. So who wants to jump in here?
Rebecca, did you cover all the questions in the chat so far? Or?
A lot of them, I think. Best validate ideas. Yeah, I think I've gone through, we've gone through all of them.
Okay, perfect.
Yeah. Does anybody want to jump in? Because I've seen a couple of you guys, we've answered, a lot of you guys had a lot of questions on co-founders and things like that, but is there some follow-up questions or things that have come to mind? How many of you guys actually are just looking to start out and do a company right now? How many of you guys are sort of in that space? Okay, so 1, 2, along you guys, that's great. So are you guys all looking into, go ahead, does anybody have any questions? Because I can keep asking John questions all day long.
Yeah, I do have a question for John. So I think that, you know, the fact that you have a excellent background and different part of healthcare, I think it's very interesting. And I'm just wondering, like working at, you know, more like traditional types of like healthcare organizations like pharma and medical device, like just wondering, like what can digital health startups you think can learn about commercialization from these traditional healthcare companies?
Mm-hmm. So if I'm hearing you correctly, what can a startup emulate or learn from pharma and traditional device companies?
Yeah.
I think what we'll see with them, where pharma and traditional device companies have always done exceptionally well, is market access, right? They have a means to get their product in front of people through this large sales force, which may be not really something that's an option for an early stage company, but they have large sales force and they have market access, which means they have a product that they can get in front of people and it's paid for. So that's something, you know, we should all keep in mind is how accessible is my product? How can my customer access it? And is it paid for? So they make it easy for their customer to get to become their customer. So because as Rebecca Love answered earlier, it gets hard when you have to start doing prior auths and getting verifying benefits and a lot of other things where you've now impacted the workflow and the efficiency of an office, and they don't want to do that. So they don't do it. They give you the next best thing. So what I would say to you is, when you think of your commercialization efforts and your go-to-market strategy, what's the way that you can create the least friction, right? Make it easy for people to work with you. Show them how it can get paid for, or how to buy from you. I think it's the biggest challenge people make is, and it's incredibly frustrating, is there's a lot of companies that have raised tens of millions of dollars right now that have no idea how their product gets paid for. They have no idea. They're out there selling the product. They go to a meeting and someone says, how much is this? Crickets. You'll have executives from a company standing there with no answer because they don't know how to price their product. They don't know how to get paid for. So have an idea of, make it as easy as possible for your end user to actually be your end user, and have an idea of how your product is paid for. And it's okay to say it's cash pay, it's paid for by the end user. That's fine if that's the way it's paid for. But there's folks now that they go in and they say, well, how do you want to pay for it? We'll figure it out. You shouldn't have to rework 100 slide deck every time you go to a meeting to go in and guess how you think the customer wants to pay for it. You know, you should know your market, how they pay for things, how things get paid for, and how they make that decision.
Thank you.
You're very welcome.
You know, I think that there's, and what John speaks about is the industry still is largely dominated by 80% of traditional models of care, right? We're still, you know, there's these things called fee for service or value-based care where the United States is going. And if you're selling into healthcare, I'm going to tell you guys a couple of non-starters for if these are your buyers, where you're going to really lose points for people investing in your company. And one of them that's like, well, the hospital's going to pay for my program. Non-starter, the hospital's never going to pay for your program. Let's just put it there. So if you're like, they're the buyer, selling into hospital systems on average is 18 months to 3 years to get into their sales cycle. So if you're looking to sell into hospital systems, you better rethink about who's going to be your buyer on your product. I'm going to make and John, you jump in here too. The other thing is though, what you are finding is what used to not be as attractive in digital health world, where they used to say consumers did not pay for digital health products. Like there's all these statistics out there. We're actually seeing a dramatic change and shift in that. The products, especially along weight loss, things like Noom are one of of the most successful out there. Livongo came together and got acquired because they went after a consumer-based market. So I think that as tech is being adopted, John, I think that actually consumer-based models, which used to be poorly funded when they used to say, hey, I'm going to get the hospital to buy it. And I don't know if you know this, but COVID basically has said that the financial forecast for hospitals going forward in the next 18 to 24 months is grim to bleak, with 350 of our 4,500 hospitals facing bankruptcy at this point in time. You're not going to get a hospital to pay for anything that is non-essential. So what do you think, John? Where's the buyers and where's the non-starters?
Yes. So here's the deal. Even prior to COVID, right, there was small hospitals, critical access hospitals, 25 beds, 100 beds, right? On average, they had less than 7 days cash on hand, right? That was a fact. So when COVID happened, they were decimated. If they weren't getting people in the door and butts in the beds, there wasn't money coming in. So it's going to be scary. The next 18 months, the next 2 years, hospitals are going, they have to make reductions, and they have to make cutbacks on what they spend and what services they can offer.
And they don't pay for things that are going to save them money. So if you're like, well, if they pay for this and it's going to save them money, the hospital's will be like, I'm not going to pay you to save me money.
And same with the provider side, right? So a doctor's office, they show them how you can help them drive revenue. Show them how.
That's the only way you can. Thank you, John. That's exactly what I wanted you to say. The only way people are going to pay for your product in healthcare is if you.
Yep, you help them make money. And then here's the other side on the health plan side of the businesses. When COVID happened, right? So you saw very weird things happening, right? You saw everybody before they lost their jobs, because all of our health insurance is tied to our jobs in this country. They all refilled their medications for 90 days, 120 days, right? Then they lost their jobs. So the pharma companies made a bunch of cash, and then there were no refills, or because it's $100 to refill it. And hey, you know what? I don't need metformin right now. I'll roll the dice for a while so I get back to work. So the health plans, they lost members because people lost their jobs. And most people in this country cannot afford COBRA for a prolonged amount of time, right? I'm a family of 5. My COBRA was $3,000 a month. Okay, that's a mortgage, right? So most people can't do that. Or you know, after 6 or 12 months, you've burned your savings and you're done. So the health plans, they've lost members. So what can they do? They can't increase the price on their premiums. So they're laying people off as well, right? So they're already their margins are shrinking. So how do you preserve margin when you're losing incoming premiums? You have to cut expenses. So you have to let go of people. So the hospitals are cutting expenses. The health plans are cutting expenses. And then folks like us, we were putting off a lot of care and procedures. And now once the world opens back up, the plans are terrified that all those procedures we put off are coming, right? We're all going to get whatever that knee replacement or all this care that we've put off is coming. So one way to combat that, and we're seeing, if you go look at Cigna or Anthem or any of the investor day calls from last month, everybody's saying digital first, virtual first, digital first, virtual first. Thank God, we're finally there, right? There's ways to provide good medicine and practice good medicine outside the 4 walls of a hospital. Health plans are finally seeing that as a way to improve engagement among their members. Pharma loves digital first because they get some action and insight and visibility to things that they didn't have before. Pharmacies now, if they have some type of data and visibility to actually how often you take your medication, how much you're taking, they don't need to dispense 30 or 90 pills at a time. They can give you 7 and then have Amazon bring you, or whatever delivery service, bring you 7 more next week. So there's so many ways to improve efficiencies. So I think now where hospitals have to reduce their spend, show them how you can bring money in the door. And that's why you see this rush to remote patient monitoring and everybody now trying to pound on those codes that CMS unbundled, because practices and hospitals are saying, okay, there's a way for me to bring money in the door for people that are not even stepping through the door. So that's very opportunistic. And a lot of companies are trying to capitalize on that, and some will make it and some will die. But there's any value you can bring to a health system to show that I can help you bring money through the door without interrupting the workflow, without putting more stress on the staff that's already understaffed, without burning out your physicians who are already miserable and burned out because they're overworked. And for the first time in our life, we're losing more physicians and nurses every year out of the practice than we're gaining. So there has to be ways to, they're enabling people and empowering people to practice at the top of their license. So that whatever efficiencies we can bring to a practice, to a health system, to a hospital, in addition to helping them make money on people that are practicing at the top of their license, that they can get at a better deal. That's opportunity for you there.
I think Brendan had a question. Brendan, did you have a question that you wanted to ask him? Might have been a while ago.
Actually, I did, and you addressed it. We were talking about the validation and outcomes, especially at the earliest stages of the life cycle of the company. John, I think you did address that. So thanks, Rebecca.
Thank you, Brandon.
Lori, does this go to 6:30? Am I just being, okay, all right, sorry. We're on for a little while longer, so we can do these things. So, I mean, what you're just talking about, that information right now, that for the first time, and I'm seeing the same exact pivot, is that for the first time, payers are saying, you know what, remote patient monitoring systems worked, right? Like COVID shut down and we used to pay for telehealth, but actually they're not going to pay for telehealth. I don't think those standalone visits, just telehealth, they don't drive outcomes. However, they found that during COVID, these remote patient monitoring patients in diabetes, congestive heart failure, all of these disease states could be really well managed better at home through these patient engagement programs than Q3-month visits at the doctor's office. Yep. So what you have an opportunity for is, to John's point, that digital first is not, they're not doing it because it was just better for patients. It's actually making them money by delaying a lot of expensive treatments that people haven't been doing, right? And so I think there's opportunities in spaces, and John, you should dive into this, in a place that they would not have considered remote monitoring or digital support before, where they did in some of, like, I'll be honest, there's been some breakthroughs in diabetes and congestive heart failure in the US, right? Because those were so high cost to healthcare systems and high cost to payers. But I think there's even other places that they're looking for that might not traditionally have been something they considered on, so we could look at some of those. But John, where do you want to go next in this conversation? Like, what things have we not talked about that you're like, I really wanted to explore here? So is there anything that we haven't covered that you're like, hey, this is something that I want to make sure that we discuss?
No, there isn't, but so I'm glad you said, so one, I know we're running about 30 minutes fast, and I take, I'll take the blame for that. I'm a Bostonian, I speak quick, and I apologize if I turned a 90-minute meeting into a 60. But we touched on so much here today, and what I want everybody to take away with, and especially the folks that are part of the Health Science Entrepreneurs Program, is that just start now. Don't wait, because there's so many ideas that I wish I brought to market 15 years ago that someone else did, right? And there's so many ideas that I wish I brought to market that would have died, but at least you would have known, at least you would have tried. And I think the other thing is, when you look for non-traditional funding sources now, that's great, and I commend you on that. But that skill set you learn, that's going to help you when you're actually commercializing your product, because when you face objection with a hospital or a health system or with a health plan, all the tips and tricks you learn now, identifying funding sources when you're an entrepreneur trying to basically fund your idea, that's how you're going to sell your product as well. So when you go to Dana-Farber Cancer Center or Boston Children's Hospital, and you're trying to place your product there, and they say, well, you're not on budget, we don't make the budget decision until October, we get the money in January, we've already missed the bid for this year, or we'll put you in there and see what we come up with. And your idea may be amazing, but you're priority number 51 and they're only funding 1 through 30. So there's other ways where if you can identify funding sources inside the hospital or the health system for your buyer, whether it's through, are they self-insured? Do they have a captive, right? Can you go to that captive, that risk management fund? And many of you don't know what that means, and that's okay. So a captive or a carrier. So you and me and everybody on this call, we often, we pay for car insurance every year, right? You pay $3,000 a year for car insurance. And if you don't get in an accident, next year you pay $3,000 again and it's gone. So hospitals used to be like that for their insurance. But then they realized was, okay, but they were paying $1 million a year. And they realized, okay, at the end of the year, if they didn't get sued, they spent $1 million and they have to pay $1 million January 1. So what they started doing was basically putting their money in the bank and not buying an insurance policy and paying cash for their lawsuits. And if you don't get sued at the end of the year, you still have $1 million. If you do get sued, you pay the claims, you still have a few $100,000 left. So they build up these massive funds that are called captives. So there's ways to secure money off budget in a hospital that if you can tell your buyer, listen, I know you don't have a budget. If you'll be my, my cheerleader, if I can help you find the money, will you be my evangelist and say how important this is? Often, depending on the price of your item, there's a benefactor that they know they can call on. There's a list of people that give large donations to their hospital or to their cause that they know they can call and get 50 or 100 grand in a phone call. Wealthy individuals that are grateful that whatever hospital took care of their mom or their daughter. And, you've got a woman who's, that's retired and has a big bank account, and she loves nothing more than giving to the hospital because they were so good to her parents, right? So get creative in the way you actually get your products funded, not just your company funded. And I guarantee you will have success. If you can make it easy for your customers to do business with you, or show them that you're working for them to help get things paid for outside of the budget they feel that they're tied to, you'll gain a lot of credibility. You'll learn a lot. And if it works in Boston, it'll work in Philadelphia, it'll work in Atlanta. So once you gain that skill set and that ability to navigate, it is totally replicable and scalable. So if you can do it at one site in Cambridge, you can do it at 10 sites in Philadelphia, you can do it at 20 sites in California. So I just encourage you to always just be open into how you get things done. The critical thinking is one thing that I think Northeastern does a great job of teaching soft skills and critical thinking skills. Just be someone who can connect the dots. Even if you have to bring third parties into it, be someone who can connect the dots. That's all I can really give you advice on.
John, this came up in a conversation with one of the listeners that I was with about a week ago in a conversation. I want to bring this up because we have a lot of women on the phone, and I think maybe we can end here if we don't end up getting more questions. But when I was a young entrepreneur and I went out and had an investor talking to me, I never felt confident taking money. But after I talked to him, he looked at me and he said, Rebecca, I want you to come back in 2 weeks and pitch me like a man, right? And I learned really an interesting lesson at that moment, that we as women, and then what we have so many women on the team, and I would love you to sort of talk about it. And what I realized is what I did is I came up with this idea and I was like, this is a really great idea. And here's all the challenges that I'm having with this problem and where it could go wrong. And I'm not sure if I should take your money. And I was very transparent in these things. So could you explain to some of the women on this group, because you're in sales, what is the strategy when you're holding the cards or you're asking for money or you're asking to make a deal and you don't blink? And it's still a problem that I have in myself, right? Like I feel really good to a certain point, but women get really, and I was a nurse, right? So I wasn't trained on those skills, but can you talk to us a little bit about what that person was saying when they're saying pitch like a man, and to men and women on this call, here's how you need to start thinking about yourself, your company, your project, and how you get people to say yes.
Yep. So thank you for bringing that up. And I appreciate the opportunity to actually comment on it. So one of my prior companies was a female founder, physician founder. And something that would drive me crazy about her is that she would always say, it's the boys club. They don't want to give me money because I'm a woman. They don't respect me because I'm a woman. And part of it, I think, was institutional, right? She came from a large academic health system where I think a lot of that experience that she had faced throughout her career was probably very accurate, or at least that's how she was treated. But in the investment world so listen, you've defeated yourself before we've even entered the room. Go in there. You're brilliant. You've created this. You're going to make somebody money and you're going to help patients and solve a problem. So that's powerful. So don't underestimate yourself and go in there and do that. So I would say don't psych yourself up based on past experiences, and don't defeat yourself before you even get in the game. And also, so a few things, and this is something I think Madeleine Albright has said at my wife's graduation 20 years ago. There's a special place in hell for women that don't help other women. And I mean that sincerely. You have to support one another. Listen, I'm Greek. I assure you, every Greek person that calls me or emails me, I answer the phone or I respond to them just because. Okay. So as a woman, you're responsible to support and build up one another. Don't tear each other down. And I'm not trying to go in this monologue, but don't tear each other down. You're powerful. You're more powerful than men are in a room. Okay. So you're doing something where you're in 1% or 2% of all founders that are actually doing something. So you're already somebody that's viewed as quite powerful. So don't defeat yourself. Go in and when we say pitch like a man, basically stand your ground, right? Don't back down. Don't be timid. Assertive women in a funding situation or in a deal room are amazing, and you usually get what you want because you can articulate yourself. And I know that sounds stereotypical, but you articulate yourself better than guys do. Okay, you are usually, especially as a founder, you're so knowledgeable about your space and you're so well researched. Come in and speak with conviction and get your point across. And that's all I can say. And there's so many groups that are specific to female founders. Take advantage of them, even though you're still going to do the same thing. Maybe it's a less punitive environment, but some of those women are savages, right? They're investors just like any other group. They'll chew you apart too, but they'll do it with the best of intentions and to make you better. So I just say the best thing you can do is good mentors, men and women, right? People that you genuinely trust, that you feel genuinely care about you. Practice with them first, and don't take no for an answer. It's that simple. You don't have to take anybody's money. If someone's treats you like crap and they have an ego and an attitude, don't take their money. Don't make them any money. So that's part of it. I think desperation sometimes comes across in these meetings because we defeat ourselves and we feel inadequate, or we feel that we're not as fundable as some other groups. That's crap. And right now, with all of the investment in this area, you don't want to be the same as every other guy that used to work at Deloitte, or used to work at McKinsey, that's coming in with an idea that went to Wharton and he's fundable just because of his pedigree. No, be different. Be someone that's passionate. You have your own background. You have your own idea. You build your own team. You call the shots. You're the captain. So, I'll leave it at that. But I just say practice as much as possible. And we reference those accelerators. That's a great non-punitive environment where you can get honest feedback that's only going to make you better.
And I have to tell you guys, and these accelerators, I never felt like I qualified for them or I was good enough or everything's like that. And for a lot of myself, I held myself back. So I thank to all of you guys for getting involved with AHSC because it gave me a lot more confidence. And just today, what I realized women do really well is we advocate really well for other people. And today I realized I was in a high power negotiation on behalf of a group that I represented. And they said, hey, Rebecca, this is how we're going to do it. And we're going to do it this way. And I looked at them and I said, actually, no, I wouldn't do the deal for this way. And here's what I need. I'm talking, it's a book deal. And I said, for me to write a book with you means that I'm going to need an advance and I'm going to need to strengthen the royalties. And I understand that you have a profit to be made. I need you to go back and draw again because I have other options. And if you want us to publish our next book with you, I need you to have these certain things established. And I remember they just sort of stepped back and I sort of stepped back and I said, look, it's not anything, it's just business. I want to support you guys, but there comes a point when I have to ask and look at the resources that I'm going to need to get this book across the finish line. We don't always do this really well. So don't be scared about these things. Let's see, Martina said. So let's talk about why aren't hospitals interested in cost savings, Martina? We can talk about that. They don't pay you money to save money is really where some of this comes out of. And the reason they really struggle with cost savings as a metric to validate paying for something. And John, I sold into hospital systems for 2 years with the cost savings things on staffing and recruiting and everything like that. And hospitals just felt that they could control those costs internally. But John, do you want to dive in and talk about, did you do a lot of hospital sales directly?
Oh, yeah, of course. Yeah, of course, for most of my career. So with that being said is, one, they won't believe your ROI, right? They view it as, they may take 5 initiatives on for a certain area to reduce spend or reduce cost. So whatever you come in with for an ROI, they'll believe you can't take credit for. We're doing 10 initiatives here. We don't actually know which one works. You're a piece of the puzzle. So that's part of it. And the other is they don't know what their numbers are, right? So whatever we tell them they can do as far as savings, they don't know if it's accurate or not because they actually don't know how to manage that spend. And it's, to them, they view it as it's it's reactive, right? So part of their budget as well is they just want to get as much in their budget as they can. So if they're spending money to save money, the hospital views that as money they didn't have to spend sometimes, because if you were doing a better job managing your floor, you wouldn't have to get this now cost saving technology. So just make a better process or protocol, and we'll start there. It's not until things start affecting the money they bring in, like through their different scores and measures, when they start getting penalized, then they'll make investments. And it's not to cut costs; they make investments to make sure that their risk adjustment or their payments are greater.
And what John's speaking to are things like patient satisfaction scores. When a payer looks at their reimbursement levels, if you have higher patient satisfaction scores, then they're going to pay you for your product, because if your product makes patient satisfaction scores go up, and they can say that, they're going to look at that. But they're going to have key centralized things. But cost savings for hospitals, they run, I don't know if you know this, but the average hospital runs on a metric of about 2 to 3% margins, which is absolutely no money. 2 to 3% is the average hospital margin, which means that's the amount that they try to keep in the bank. And as John said to you, 7 days cash. So saving money for them, spending money to save money doesn't work, because what they're really driving to is the payers for their reimbursements, or why they fund doctors is because they drive revenue. And the number one place or floor in the hospital that drives money for the hospital is the operating room. So if your product is dealing with med surg or it's dealing with ED, unfortunately, those are cost structures to the hospital system. Because if it's dealing with nursing, that is a cost structure to the hospital system. So you need to be looking at the places that make money: operating rooms, ICUs, and let's be honest, maternity a little bit, but they still consider that cost loss. But or patient satisfaction scores. It's a tough sell, you guys, but it's not. If you have an idea, let's just think about how you reframe that conversation to go into hospital systems.
It had actually a second part, it was like more of a surprise that they would not be interested in money savings, but thank you for explaining. I'm also curious what you think about how this applies to payers.
Yeah, payers, they will invest in saving money sometimes, right? So it's a little bit different where they're interested in risk stratification, or the ability to identify people earlier to prevent later costs, right? So if I can identify someone earlier in their journey to prevent them from presenting themselves in the ED, it may be worth it for them to spend X amount of dollars to save X thousand dollars, right? So if a typical ED visit, emergency department, if a typical ED encounter costs $15,000, if I show up there for drink myself unconscious, or I have some type of psychiatric breakdown, then it may be worth it for them to invest in something that flags me in their system 6 months sooner to say, okay, he's exhibiting behaviors that will likely end in one of these two possible scenarios. Let's proactively intervene now. So if they can direct me to, in this company, I'm part of a company that does this, we'll direct you to a less expensive modality of care sooner to prevent you from ending up with a major medical encounter. That's valuable, and they'll spend in that capacity because it's actually it's a cheaper encounter, but it's not because they're ultimately saving later on. They're actually able to engage people sooner in their journey to manage their future expenses better, or avoid future expenses. So not necessarily an immediate cost savings. It's an indirect savings, but they can see the journey.
Okay.
Let's talk about, oh, go ahead.
Yeah, thank you. It seems that the preventive or the long run things may actually be more feasible through payers then.
Yeah, so Martina, the problem is, and I can't even say the system is broken, because it's not broken. It's working exactly how it was built to run. Physicians and hospitals, they don't get paid if you're healthy. They get paid when you're sick, right? So there's some different type of value-based care models where we're fixing that, and people are starting to get incentivized to keep you out of the hospital. But when you show up at the ED, they're ready. Hey, open the cath lab, open the OR. We got some money coming in, right? So that's how they make their money, is butts in the beds, is to get people in the hospital and charge you $38 for a Tylenol. So we've got to figure out if we can fix the models of care where folks are incentivized, and you're seeing more provider groups go at full risk, meaning they'll get X amount of dollars per year to manage your healthcare. And if they can do a good job and manage you for less than that, they make money. And if they can't do a good job and you cost more than that, well, they lose some money. So there's things that are coming to fruition that are more in line with actually practicing preventative medicine that are finally starting to incentivize people for keeping you healthy and keeping you home.
And what John is talking about, if you haven't heard that, that is actually referred to as value-based care, which payers are pointing to, where before you chose across a hospital system and we used to be fee for service. So that's why they would order all those tests for you. And that's how your hospitals made money. When you step into it, you don't need pre-auths or prior auths, usually when you're actually in the hospital. So hospitals were largely not incentivized to keep costs down, as at least that was the feeling. That being said, that is a whole other conversation with experts, similar to John, better than me to have that conversation. But here's the thing, let's talk about next steps. Connect with John on LinkedIn if you're not, right, John? They should go and connect with you on LinkedIn.
Please do it like today, right now. Go find me on LinkedIn and let's connect. And I'd love to, foster some form of relationship with each of you, even if it's just through seeing each other's feeds. But please, I'm grateful, Laurie, Rebecca, Danny, if you're on, everybody at Northeastern, I'm so grateful. And, it's an organization that's just so dear to my heart. And I just appreciate it. And Rebecca, thank you. Every time I talk to you, I leave the conversation just so energized and just learning so much. So thanks for always being just a great thought partner and so accessible for 4 or 5 years now. First time we met. So I'm grateful that
Well, it is an honor to even be on the stage with you, John. And you guys, please connect with us. The truth is, John and I actually, John was significantly more successful 5 years ago than I was in life and still has grown to be those things. But you guys, who you get to know really does things. And if we can connect you with anybody, I think John and I both realize the power of relationships, or just the power of opening up and putting 2 people on an email. That's, I think, how we've lived a lot of our lives, is just introducing others so that they can go out and be successful. We're a big believer that if you just let more people in healthcare try to connect, we would do some great things. So John, without that, I'm going to turn it over to Lori. And
yeah, thank you both so much. Thank you to everyone who attended and those who will be viewing this webinar on your own. This was a wonderful session. I learned a ton. Very grateful for both of your participation in this, and look forward to the journey. I also want to just say that on May 20th, we're having an event called Curated Collisions from 2 to 5, and it's all focused on digital health and wellness. We have a great lineup of people participating, and Rebecca will be one of them as well, probably John, and many others from different organizations in this space. So we look for information on that for those of you who are viewing that, for those of you who are here. And with that said, go enjoy this beautiful day for those of you who are in New England, and we'll see you all next time. Thanks again.